Hey, this is Dr. Scott Hoar, and this week's tip is regarding neck stiffness and sometimes even headaches that can be caused from dysfunction of the neck. So what I'm recommending you do is a movement or exercise. It's called end range loading, where we go into cervical spine retraction, okay? And what I mean by that is cervical spine protraction, we all know it like this. We think of like poor posture patterns is like this. So retraction is the exact opposite, all right? If you want to know if you're doing cervical spine retraction correctly, if you're getting a double chin, then you're doing it correctly, okay? And what you're going to do is you just repeatedly go into retraction. Don't protract, you don't need to go forward all the way, but you just repeatedly do this. You'll actually probably feel stiffness, pain, and discomfort the first couple of reps you do the cervical spine retraction. And your job is to just keep going. If after 4 or 5 repetitions, the discomfort starts decreasing, then you know that this is actually a great strategy for you. Now, if you do 4, 5, 6 retractions and the pain and stiffness continues, or maybe even gets worse, then you want to cut it off. This is not the right strategy for you. Give us a call in the office. We'll check you out and make sure which strategies we're using for you or not. But this is a great one to try. Repeated retractions. You'll have to make sure nobody's looking at you. Maybe do it in the elevator or in the car. That's the best place. That way nobody starts giving you weird looks. But that's this week's tip for neck stiffness and headaches. Do cervical spine retractions.